Wisconsin Governor Scott Walker is hoping to set aside $3 million for programs that could help address a shortage of healthcare providers in the state's rural areas. Part of that money would go to the Wisconsin Academy of Rural Medicine. It's a program with 4 sites around the state, including one in La Crosse. News 8's Pauline Lee shows us how the program is able to help encourage medical students to practice out in rural communities.
It's a goal that's still several years away.
Hello, Corinne.
But Ryan Lyerla would like to one day practice medicine in a rural community.
The nice thing about being in a small community is any actions, anything that you do can resonate throughout the community, can have an impact.
He knows firsthand, having grown up in Edgerton and being the son of a family physician. Lyerla hopes participating in the Wisconsin Academy for Rural Medicine, or WARM program, will help give him more insight into rural medicine.
And how is that going for you?
The program allows medical students from the University of Wisconsin-Madison to spend time with patients while learning under physicians working in rural communities.
I had an opportunity to work with everyone and participate actively in people's care, and I thought it was really cool being able to see what being a rural physician was like in Toma.
Some students also spend part of their time learning at Gundersen Lutheran in La Crosse.
Can you take a deep breath for me?
Gundersen has been part of the program for 3 years.
The WARM program is really our state's answer to trying to fill this lack of rural providers.
The program in western Wisconsin only has 10 spots for students a year, but Dr. Kimberly Lansing says more and more students are applying every year for the hands-on experience.
It's like a total immersion program where they go out and they live the life of those doctors out in the smaller clinics. They see patients, they may get involved in community medical activities. They really get a chance to live in these small towns and see what their life would be like if that's what they choose to do in the future.
Do you have any questions or concerns?
And so far, Lyerla says the experience has been invaluable.
It gives me a leg up, and it gives me the idea that that is some position I'd like to see myself in someday.
Reporting in La Crosse, Pauline Lee, News 8.
It's still too soon to tell just how effective the WARM program is for increasing the number of physicians in rural communities. The first group of students that have gone through the program are currently finishing up the residency training before they can go practice on their own. Now, if Governor Walker's budget passes, officials at Gundersen hope to increase their program from 10 students a year to 12.